All right, so moving forward this semester, we're going to start talking about exercise testing. So, as you know, there's different components of physical fitness, and we have different strategies to assess those different components of physical fitness. So, we're going to start by talking about body composition. So, for starters, body composition is the relative proportion of fat and fat-free mass in the body. So, this may have implications regarding health and also physical performance, and also, as we were discussing in class, just a way for people to assess and monitor their progress in some type of exercise program or dietary intervention. So, as you're probably well aware from just looking at BMI, there's different categories that you can be put in related to body composition and not only BMI but overall percent body fat. But the difference between overweight and obesity. So overweight simply means just body weight in excess of some standard. So a lot of this is just based on either BMI or maybe a height weight chart or something like that. Obesity itself refers to a surplus of adipose tissue on the body. So it is possible that you're overweight and completely healthy and actually may have a low percentage of body fat, but obesity implies that you have a lot of adipose tissue in the body as well. So, as far as different types of fat, uh, fat is primarily stored in two places in the body, either subcutaneous, which is under the skin. So, within the skin, there's a epidermal layer, then a dermal layer. Underneath that, you have a layer called the subcutaneous layer, or sometimes it's called the hypodermis. But that's a lot of adipose tissue under there. So that is the whole basis for using skin folds as a measure to estimate percent body fat. Visceral fat, on the other hand, refers to internal fat that is deep inside the body and tends to accumulate around some of our vital organs, like the heart and other organs within the thoracic and also abdominal area. So, comparing the two, visceral fat appears to have the most risk as far as cardiovascular and health risk. So, back in the day, whether you were overweight or not, went back to just simple height weight charts. So these were developed a long time ago. They were mainly developed by life insurance companies to assess their risk of these policies that they were giving out. So you can see here, there's just all this is a suggested weight based on your height, and it is categorized by body frame size. So that can be a part of it also. But simply put, it's just a recommended weight based on your height. So BMI is very similar, but it's just a number that you calculate based on height and weight. So weight divided by height squared is how you calculate BMI. And when you do that, you'll get a number that's usually going to fall somewhere between around 17, 18 and up to maybe 30 or 40. So you can see the ranges here, the classification scales. So anything, the normal range is considered 18.5 to 24.9. Slightly above that is overweight, and once you get above 30, there's different classes of obesity. And then it's possible that you're underweight also if you have a BMI below 18.5. So BMI is limited because, again, all it does is assess height and weight. So you could potentially have people with the same BMI that have completely different body composition. So this picture kind of describes that. So these people have the exact same height and weight, but you can tell their percent body fat is probably drastically different. And regarding BMI and health risk, as you can imagine, the higher BMI gets, the risk does go up. And that's what you're seeing on the right side of this curve. But also, it's important to understand that if BMI gets too low, that's also a risk. So you see a lot of this with people who have either eating disorders or maybe have some type of condition that involves muscle wasting. So one of the things that we can do that doesn't give us a direct index of body composition, but just kind of gives us an idea of the size of different parts of the body. We can do circumference measures. So we simply measure the circumference of different body parts. When we do this, we use a tape measure, preferably a Gulick tape measure that has a spring in it where you can standardize the amount of tension that you're putting on it. When you do this, you generally rotate through different measures of the body. So the common sites are abdomen, arm, buttocks slash hips, calf, forearm, hips thigh, mid thigh, and waist. And then you can calculate a waist to hip ratio. So when you do these, you generally want to do them all and then do them all again. And you want to make sure that you're getting consistent numbers. So to be consistent, they're supposed to be within at least 5 millimeters of one another. So if they are, you just take an average, and that's your circumference measure. So these are the major sites that we do circumference on. The landmarks are important. So for arm, key point midway between olecranon and acromion process. Forearm, maximal circumference of the forearm. Abdomen, greatest anterior extension of the abdomen, which is usually at the level of the umbilicus. If you're unsure, just measure it at the level of the belly button or umbilicus. For waist, this is a little tedious, but it's basically the circumference of the waist at the narrowest part of the torso. So anywhere above the umbilicus and below the xiphoid process. So if you can't find what you would consider the narrowest spot, you just need to be consistent in where you're measuring it. So for buttocks, hips, which is important for getting the waist hip ratio, basically the maximal circumference around the butt area, and then the hips thigh, just below that, below the gluteal fold, standardizing how far the legs are apart. So about 10 centimeters apart is what's recommended. So if you standardize that and get the measurement, it should be pretty consistent. Mid thigh, you want to bend the knee at 90 degrees, and then midway between the top of the patella and the crease at the hip, the inguinal crease. And then for the calf, it's just the maximal circumference of the calf region. And then with the circumference measure, you can get a little bit more data. So by using the waist and the buttock slash hip ratio or measurement, you can actually get a ratio called the waist hip ratio. And that gives you some idea of body fat distribution between the upper and lower body. And I put up here some numbers, what's considered very high risk for men and women. And just remember, as a risk factor, to have a risk factor for obesity, as waist circumference itself is criteria for a risk factor. So men greater than 102 centimeters, women greater than 88 centimeters. And then the whole rationale for measuring the waist hip ratio is just to determine the level of body fat distribution in the body. So if you tend to store a lot of body fat in the upper body, that's referred to as android obesity. And this is what a lot of men tend to exhibit. And if you have a lot of body fat distributed around the hips, the lower body, that's called gynoid obesity. And women, on the other hand, tend to have this more than men. So as far as health risk, the android type, the apple shape appearance, is thought to be more risky as far as cardiovascular disease and metabolic disease such as diabetes. So one thing that we will be doing in class is measuring skin folds. So I want to talk a little bit about skin folds. So skin fold thickness strictly measures the subcutaneous fat that we talked about. Skin fold thickness is assessed at various sites on the body. And we're under the assumption here, and it's relatively accurate, that subcutaneous fat under the skin is proportional to your total body fat. So it's a pretty good assumption that we're making. The major sites that we do skin folds on: abdominal, triceps, chest, mid-axillary, subscapular, suprailiac thigh, biceps, and calf. And in most instances, we'll only use 7 of those to actually get an index of percent body fat. So how accurate are they? Any measure that we do to assess percent body fat is going to be an estimate. Some are better than others. So skin folds is actually decent, but there are some things to consider. So the technician who's actually doing the skin fold assessment is probably the biggest source of error, or potential error. So it takes some training to get comfortable and make consistent measurements with skin fold calipers. So that's one source of error. And then different body types too. So sometimes people with a lot of body fat or even too little body fat, it tends to be more difficult to actually get the skin folds. So again, what most evidence shows is that there's an error rate of about 3.5%. uh, when you use skin folds to assess body fat. So procedures for doing skin folds. We want to do them all on the right side of the body unless there's a reason that you cannot. The subject should be standing up. Caliper placed directly on the skin surface, about a centimeter away from the thumb and finger, perpendicular to the skin fold, and then you just measure the thickness. And then you keep holding the pinch while you put the calipers on it. Read what the millimeters are, and then you remove the caliper and then let go of the skin. So you want to do this in about 1 or 2 seconds because the fluid within the skin could start affecting the measurement. Again, you want to do duplicate measures at each site, and so basically cycle through the measures and then cycle through again. And then again, you're looking for consistency here. If they're not within 2 millimeters, you should do it a third time at least until you're getting consistent measures. And then you take an average of the 2 at each site, the best 2 at each site. So once we get all of those measures, we generally want to sum them up and just get a total. We call it the sum of the skin folds. So here's a picture of these sites, and we'll go through some more pictures of these sites. So the landmarks, again, are really important here. So for the triceps, back of the arm, halfway between the acromion and olecranon process, subscapular, about 1 to 2 centimeters below the inferior angle of the scapula, and this is a diagonal fold. So with these skin folds, you will see that some are vertical, some are diagonal, and there's a reason for that, but I mean, that's just the standard way we do it. For abdominal, 2 centimeters to the right of the umbilicus, it's a vertical fold. Superiliac, you find the iliac crest, and you want to take a diagonal fold right near the top of it, kind of in the natural line of the iliac crest, right in what's called the anterior axillary line, which is basically in line with your armpit. Mid-axillary vertical fold, this is on the side of the body at the level of the xiphoid process, but it's all the way on the side. So to do this measurement, usually you have someone kind of hold their arm out, and then you're able to get the measure right here on the side of their torso. The chest, it actually differs for males and females, so diagonal fold for both. But for men, it's about half the distance between the armpit and the nipple. For women, it's a third of the distance. And for biceps, biceps is one we don't generally use when estimating percent body fat, but you can still get it. And it's right over the belly of the biceps muscle, really close or almost at the same level as the triceps site that you used on the other side. And according to the recommendations, about a centimeter above that level. And thigh, vertical fold in the middle of the thigh. And it's midway between top of the patella and the inguinal crease, just like we saw for the circumference measure. And for this one, generally what I would recommend is have the person put all their body weight on one leg, and then one leg just dangling, the leg that's dangling, which would be their right. That's the one you get it on. So you don't want them actively contracting the muscle when you're getting the skin fold. And then for calf, it's the inside of the calf, medial calf, vertical fold at the maximal circumference. Again, this is another one that's not commonly used in the equation to estimate percent body fat. So once we get those skin folds, there's different formulas that you can use to get what we call body density, how dense the body is. So we can do a 3-site formula or a 7-site. So if we're getting all those sites that we just mentioned, it makes sense just to do the 7-site. And you can see the ones that are included in the 7-site. So there's no calf, no bicep. Everything else is in there. And so you put it into this equation right here, males, and there's another one for females. You'll put in the sum of those 7 skin folds that you got. And then age is a factor that goes in it also. And then once you do that calculation, you're actually going to get a measure of body density, which should be around 1. So if you're not getting a number around like 1 point something, then something's probably not right. And once you get that body density number, you can convert it to an estimate of percent body fat using other equations. So these equations are actually, there's different equations based on different ethnic backgrounds. So as you can see here, there's equations for males, females, and then also different ethnicities. And the standard one that has been used in the past, if you are unsure, is it's commonly known as the Siri equation, and it's this one right here. So 4.95 divided by body density minus 4.5. That's the classic Siri equation, but again, that was the first one that was developed, and now there's these more specific equations that actually take ethnicity into account, and that's important because different ethnic groups tend to have different bone density, and that can actually play a role in the estimates of percent body fat. So other ways we can assess body fat, so that are a little more expensive and things we won't necessarily be doing in this class, but I just wanted to bring them up and show you that there are other options. So densitometry basically is estimating body density from mass and volume. In using the skin folds, we do estimate body density, but those are all based on regression equations. With these other techniques, you can actually get body volume, and then we can get body mass pretty easily and actually get a better index of body density. So body density is simply body mass, which is your body weight divided by body volume. So mass is easy to get. Just all you need is a simple scale, easy to get. Volume is the issue that's challenging. So you can estimate volume, body volume, by underwater weighing, which is in the past considered the gold standard of assessing percent body fat. And it's based on the whole idea that if you go underwater, you're going to lose weight, and that weight that you lose is proportional to your body volume. And that's known as Archimedes' principle. So by getting that estimate of body volume by using underwater weighing, we can easily get body density. Another strategy that's a little easier on the participant is air displacement plethysmography. So it's still the same thing, you're getting volume, but this time instead of using water, you're actually measuring the amount of air that a body displaces. And there's these things, we have one in our lab called the BodPod, and it actually just measures the amount of air you displace. So you can see the errors associated with these are actually pretty good. Like I said, underwater weighing has classically been known as the gold standard or the best, but there are some other techniques now that might even be more accurate. So one of these is DEXA, dual energy X-ray absorptiometry, and this is thought to be the best or give you the most accurate index of body composition at this point in time, but really expensive, and it requires a trained and certified technician to actually perform it. So the way it's done, you lie down, total body X-ray is done. This participant doesn't really do anything but lie there, but you get this nice scan and image of the body, and they can actually tell what tissues are in the body and how much. And so you can actually get percent body fat in different parts of the body. So this is thought to be the most accurate, errors as low as a little over 1%. And then bioelectrical impedance you will come across a lot because it's very common, really easy. It's based on the process that a small electrical current is passed through the body, and as we know, fat has a little water in it, so electrical flow is not good. Muscle has a lot of water, so it conducts electricity pretty well. And just by measuring the resistance to electric flow through the body, you can get an idea of what constitutes the tissues of the body. So there's different types of bioelectrical impedance systems. So the cheapest and probably most common one you'll see are these little handheld ones. You commonly see these at gyms. You just hold it, you put in some data like age, body weight, etc., and it just sends a mild current through the body and gives you a rough index of percent body fat. Then there's even better bioelectrical impedance techniques and equipment like this. This is a research grade. This is called a Sika at the bottom. This works out bioelectrical impedance as well, but it's considered a research grade device. So it's a little bit more accurate on average than the handheld ones. But the error just depends on which system you use. If you use a good system like the Sika, probably on the better end, so maybe around 4% error. Handheld can be anywhere up to about 8%. So you're starting to get a little bit off sometimes using those. And then lastly, I just wanted to present some body fat norms. You can see they're based on age and also sex. So there's a chart for males, chart for females. And then you can see what's the percentiles, uh, like what's considered excellent, good, poor, and then that's also changes with age because as you get older, people tend to accumulate more body fat, so the norms actually change a little bit.